Hi everyone, I'm Giovanna Alexsandra and welcome back to The Glow Show. On today's episode, I'm joined by Dr. Sharma Bishop, who specializes in internal medicine and is here today to talk about the rising cost of healthcare, cosmetic procedures, and the after effects of the coronavirus. Let's get started. So you've been a doctor with over 14 years of experience, and you had your work published in the Journal of Global Infectious Disease, and you've launched a virtual platform that brings healthcare to your fingertips. What were some of the issues you were finding as a doctor between your patients and the healthcare system before and after the pandemic?
Before the pandemic, some of the issues I encountered as a doctor included access to healthcare services on the part of patients. Patients complaining of very long wait times, challenges in communication between patients and providers. During the pandemic, those issues were exacerbated by resource shortages, increased demand for healthcare services, and also we've had lots of disruption in regular healthcare, including patient scheduling in office. Prior to the pandemic also, there were social issues. However, they became more prevalent after the pandemic. Post-pandemic has shown quite a significant increase in social issues, more psychosocial issues such as anxiety, depression, homelessness. In fact, even social issues as a result of financial issues that patients face post the pandemic. There have been instances where the main providers for family have lost their jobs or had to relocate or do remote tasks, and that caused a lot of psychosocial pressure on those individuals. And as a result, primary care doctors in the primary care setting has had to deal with increased mental issues and anxiety, depression amongst patients.
And I agree with you because I remember just off of self-experience, I didn't even want to go into a doctor's office because I was like so scared to go in there. And I just love that now there's access to online. And let's just face it, many Americans are struggling with the rising cost of healthcare and just plenty of us who don't even have healthcare. What are some of the most basic requirements they should be looking for? And can you recommend any good services or websites, programs that can help them?
The basic requirements that individuals should look for in healthcare include affordability, coverage for essential services, and ensure that that service provides adequate preventative care, as well as whatever procedures and other healthcare services. Including access to primary care providers. There are resources like Medicaid and community health centers and government-sponsored program resources that provide assistance to patients without healthcare coverage. There is a website, healthcare.gov, that helps individuals explore different insurance options and eligibility for different subsidies. So I always encourage patients, they can visit that website and they can get more information regarding different resources. Affordable healthcare is available, also Medi-Cal, Medicaid. Lots of patients can reach out to government-sponsored programs to be able to assist them.
And as a doctor in administrative medicine, and you're currently a medical director for an insurance company, and for their clients, and you also do residential care program. I know you also are involved with cosmetic procedures such as Botox and filler. What percentage of your time would you say is committed for each one? And are you also seeing that younger patients these days are wanting more cosmetic procedures?
That's a great question. Yes, currently I do more administrative medicine. I would say probably about 80% of my time is focused on administrative duties, being the medical director, doing a lot of policies, procedures, protocols, managing doctors, hiring, terminating, disciplinary actions. And I do 15% internal medicine, and I would say currently 5% aesthetics. Prior to 2023, I did mostly 80 to 90% in internal medicine, 5% administrative medicine, about 15% aesthetic medicine. And yes, I agree there has been a noticeable trend of younger patients seeking cosmetic procedures in the recent years. Factors like social media influences, Facebook, Instagram, advancements in non-invasive treatments like injectables, dermal fillers, Botox, and awareness of patients of the aesthetic industry has increased a lot of use from younger patients. Cosmetic surgeries as well as non-invasive surgeries such as Botox, fillers, they tend to boost patients' self-confidence and enhance beauty, and they also address signs of aging and improve skin texture and enhance facial features and other body features. So they are more commonly used by younger patients more and more currently.
I also have seen that a lot of people are taking medication, and my mother, when she was alive and here with us, I saw my mother take so many medications, and I know that people are trying to really get a grasp on that and also want to know other tips on managing chronic pain without relying on medication. Is there some advice that you can give our viewers, that you can give a couple of tips on, instead of going the medication route, also going the healthier route?
I'm so sorry to hear about your mom, first of all. And yes, there are lots of different non-pharmacological options. We will discuss some of the chronic treatments for non-cancer patients. Chronic pain is one of the most common reasons that patients seek medical attention, especially in the primary care setting. And tips for managing chronic pain without medications include lifestyle modifications, changes in diet. For instance, healthier diet results in weight loss, and that can help with reducing pain for certain conditions like osteoarthritis. Also, patients with gout, reducing uric acid in the blood level diets that help do that can also improve pain. Also, managing stress, there is psychosocial components of pain. So relaxation techniques, managing stress, regular exercises, yoga, therapy, better sleep hygiene, all of those things, even heat and cold therapy, alternative medicine, psychotherapy, cognitive behavioral therapy, all of those things can help with non-pharmacological treatment of pain. Of course, as primary care providers, we do have to individualize treatment plans. So my best advice to patients is to always follow the treatment advice of your provider, but there are a long list of non-pharmacological treatment options. We always recommend a multifactorial approach in treating pain.
Yes, and I love that. So thank you for stopping by the Glow Show today. Can you tell our viewers where they can get all of your information and find you on all platforms?
So I currently see patients full-time at Gateway Medical Center in Anaheim in California. And I also launched a telemedicine platform, SBMD Care. That's sbmdcare.com. That's the website, as well as I can be found on Instagram as BMD Care and then Facebook as BMD Care.
Well, thank you for tuning into the Glow Show. Until next time, stay glowing.